several reasons why we may not access care on a regular basis. One is because we don't always have continuous health care insurance if we have any. The other may be actual physical transportation. Urban settings, we tend to be more likely to have to take public transportation and don't have our own vehicle that we're driving back and forth. So we want to think about other potential reasons why Black women aren't getting the care that they deserve to get. And it may be as a result of them not having trust in the healthcare system or in the healthcare professionals at a given facility. And some of it may be from personal experience or family experience or what you may have heard about it, but it's just that our voices aren't heard. And I want to emphasize that it can happen with all women in general. Let's take pregnancy. There's some biases built in, so there's probably no father for her baby, or she doesn't know who it is, or the father's not involved. Probably wasn't using birth control and wasn't planning this pregnancy at all. And sometimes that can't help but be manifested, and the woman picks that up, and then she doesn't want the care there because she doesn't trust them to hear her or believe what she's going to say. And so if I'm sharing with you either that this seems new and I've never had anything like this before, or that I've had something like this before and this is what it was, healthcare professionals should be listening to me. And that doesn't always happen. In the United States, a Black woman is 2 to 3 times more likely to die related to a pregnancy than a white woman is. It is so important that you're advocating for yourself, and here are some ways to do that. My first piece of advice would be to know your own health history and be able to share that with your healthcare professional. Know your family's health history and be able to share that. That and can impact what happens to you during your pregnancy and after your pregnancy. A place to start would be by asking relatives in your family. And it may not be your mother or your father. You may have an older sibling. You may have a cousin that knows. Your grandparents may still be with us and you can ask them. And the questions have to be direct. It has to be, does anybody in our family have high blood pressure? Did someone have a heart disease or a heart attack? The other thing is to learning to be your own advocate. So speaking up. Well, how do I speak up if I don't know anything? Well, it's about educating yourself and knowing what you're entitled to is another one. So if I'm going in for medical care as a pregnant woman, what is the care that I should be getting? And so it's educating yourself about what that care should look like. And then doing research to understand what questions to ask. I really do mean educating yourself before your visit as much as you can, and not just from your friends and family and neighbors, but reliable resources where you can then ask questions that are related to your care. And if you're not able to advocate for yourself, then please have someone accompany you who can advocate for you. And that's a discussion you have with them beforehand, so they have an understanding of what your needs are when you go into that care setting, so that if you're not able to voice or you need support from someone else to ask questions, you're on the same page and trying to get the best that you can so you can have the best health that you can. So it's going to be so important for you to follow those things before you're pregnant, during a pregnancy, and during a pregnancy, making all your prenatal appointments, and then afterwards following up. Focus tends to be on the baby, but you need to follow up for yourself because your health is at risk also. I think it's important that we remember, no matter what we have, no matter what our economic status is, no matter what we think we are entitled to, your health truly is your wealth.